welcome to the Voice of Pancreatic Cancer podcast. I'm Miranda Weinberg with the Seena Magowitz Foundation.
I'm Susan Tsai. I'm a surgical oncologist at the Medical College of Wisconsin. Thanks for joining us on these monthly podcasts. We're really excited today to have Kersting join us. She is a licensed clinical psychologist who provides counseling and psychotherapy to patients that are treated here at the Medical College of Wisconsin, specifically in the Surgical Oncology Division. And she works very closely with our pancreas cancer patients. Just a little bit about Dr. Kersting. She completed her undergraduate degree in journalism at University of Wisconsin-Madison, and then went on to receive a PhD in counseling psychology at VCU, Virginia Commonwealth University in Richmond. And then she also did postdoctoral fellowships in clinical health psychology at the VA, kind of a place near and dear to my heart, in Dayton, Ohio. And she's joined us in 2016. So we're very excited to have her join us today.
Thanks. Thank you so much for being here with us, Dr. Kersting. And if you don't know about the Seena Magowitz Foundation, just a quick introduction. We're a nonprofit that's committed to the awareness, prevention, and cure of pancreatic cancer. So thank you, ladies, for being here. Dr. Kersting, I think we could start with you. Maybe you can introduce yourself a little bit more, talk about your background, and what brought you to where you are today.
Sure. So like Dr. Tsai said, I started out in journalism, and that was kind of my first career. And then I got interested in counseling and some of the helping professions. I actually worked as a writer, writing about psychology for a while before I went to grad school. And then I did a PhD specifically in counseling psychology with an emphasis on health psych. And then additional training in behavioral health management, and interestingly, integrated primary care is kind of where I started. And that's a practice that puts psychologists in with primary care doctors. And that was really great training to work with a lot of health providers to get me set to work with pancreas patients and all of their providers in a multidisciplinary sense.
Awesome. I started in the journalism industry as well. So it's kind of interesting how we both ended up kind of in this arena.
I always tell people it's the best undecided undergraduate degree.
Good to be a expert in everything.
Yeah.
Okay.
Karen, you mentioned a little bit about health psych. And as you kind of introduce us to how you became interested in being a psychologist, maybe can you help define what health psychology is versus other types of psychology, and why you're specifically interested in working with cancer patients?
Sure. So health psychologists start off with the same set of skills that any psychologist has. Certainly, I work with patients on issues around anxiety and depression like any psychologist would. But in addition to that, I take a step back and look at everything that's going on with the patient, specifically for patients who are facing a major health crisis. That's a very stressful situation, and there's a lot of components to it that are useful to have a unique lens on. So I did training specifically in health settings to know how to interface with other providers, physicians, nurses, dietitians, all kinds of different therapists to be able to support that communication. Additionally, there's a lot of behavioral issues that come up when you're facing a major health issue. So what's a behavioral issue? A behavior is anything we do, right? So that includes things like eating, sleeping, socializing, all of those pieces of our life that are really important to have on the right track. And they can get especially difficult when you're in the midst of a health crisis. So I tend to look at those behaviors as well and help people figure out what is most helpful to them as the patterns in their lives.
Okay. And then where in the process do you usually meet the patient? I mean, is it at the beginning, or what part of the...
Yeah, it varies quite a bit. So some patients, want to have support and therapy right at diagnosis. That's certainly a very difficult time, or shortly after diagnosis. Others feel fine at that point, and they're coping well, and they've got all kinds of cheerleaders in their life, and they're doing fine. But then you get into the process of neoadjuvant treatment. surgical treatment, then adjuvant treatment, and it's a long haul, and a lot of things can come up along the way. So, for example, sometimes when patients are going through chemo, they start to feel really down because of the difficulties of managing that. And then I might be brought in to work with them at that point. Additionally, the recovery after surgery can be difficult. So I often come in and work with patients at that point as well. So it's really important for the providers I work with to keep their eyes open about when a patient might be in need of support. And additionally, I am working to develop protocols and strategies to have me face-to-face with patients early in the process so they know who I am and have a face to think about when they're ready to reach out.
And Karen, maybe I can ask you a little bit more about that specifically, because I think sometimes my patients are hesitant to engage early because they don't foresee that they have any issues. But I sometimes feel like it's like going to the doctor for preventative medicine, like you go see the doctor so you don't have problems down the road. So can you maybe speak to that a little bit?
Yeah, I really like to see patients as early as possible. And those sessions can actually be really positive. So I ask a lot of questions to find out what kind of support the patient has, what their attitude is, are they feeling hopeful? And sometimes I have the great pleasure of being able to say, okay, you get a gold star for coping at this point. You're doing great. But I want you to know that these are some things that can come up and can be difficult. Please stay in touch with me. Please reach out whenever you need it. So that kind of support early on, especially to think about how you're going to cope with 3 months of fatigue after a surgery. What are you going to do to get through that? Talking about that sort of thing ahead of time can be very helpful.
And for someone who's never seen a therapist, can you maybe walk us through what happens during the first session when you're meeting folks?
Sure. This is a great question. I really like answering this one because I want people to know that it is not as intense as the thing you saw on TV last week. It's just not. So when I bring patients in, I first start with getting some background information about them. And at this point in their process, they've probably given their background information half a dozen times to different kinds of providers. But my lens is a real focus on who are the people in their lives that are supportive of them, how they've been coping so far, what they've done in the past to cope, and additionally, what they enjoy doing, what makes their life good, what makes them happy. So I'll start with a bunch of questions like that. I also like to know about people's relationships, who they live with, who they feel best with, the people in their lives. And then I'll, ask some questions about their mood. Are you feeling down regularly? Are you worried regularly? How is that impacting things like sleep and eating? To kind of find out how all of that is working. And then we'll work together to identify the issues that could use some tweaking or some specific support around managing anxiety or depression symptoms.
So in that capacity, I think some analogies that I see are almost like, like a coach, basically, that, in some ways you hear about executive coaching and athletic coaching, and maybe this is maybe healthcare coaching.
Absolutely. Absolutely. And if you think about it, moving towards surgery, you're about to face one of the most difficult things you'll ever go through. And so it makes perfect sense that you should have additional support, regardless of whether you have anxiety or depression problems, regardless of whether you've had perfect mental health your whole life. You're headed towards something difficult, and that merits a conversation about how you're going to get through it as best as you can. So we can call that coaching. We can call it a number of different things, but I think it's important for everyone to have that kind of opportunity.
And what would you say to maybe a family member that wants to encourage their loved one to reach out for something like that? Maybe they're more hesitant. It's such a touchy subject. And
it is touchy, yeah. And there's still a lot of stigma out there, especially for people who've maybe never talked with a therapist. So family members can help in a lot of ways. I think one of the most important is talking about their own experiences with mental health treatment. If you've had a positive experience, it's really important to go into detail about why it was positive for you and talk to your family member. I think that goes a long way. Also, just acknowledging that they're going through something very, very difficult and they deserve to have support. And another piece is if people are struggling with specific problems like sleep or eating, panic attacks, even pain, those can be reasons to come see a therapist that don't lean on ideas around mental illness. So those can be a great opportunity to get started with someone like me to work on a specific issue like sleep and then venture into other areas where I can be supportive.
Yeah, I think that's a really great point, Karen, because I feel like there's some hesitancy because oftentimes people think of maybe seeing a psychologist as associated with mental illness, but it certainly is not. And so, I think a lot of people would say, isn't it normal to feel kind of sad and scared, in this situation? Wouldn't everyone feel that way? And why should I see a therapist? But I think you're giving a different perspective to that.
Yeah, absolutely. And you bring up a great point. The system is set up so I do not need to find depression or anxiety. I don't need to diagnose you with depression or even an adjustment disorder to have you be able to see me. And you're right. It makes sense to feel sad and scared and worried. So I take all of that into account when I'm working with patients. Now, if you're experiencing the kind of worry that keeps you up all night, that prevents you from being able to enjoy time with your family members, then that might be something that we would work on specifically. But you're right. Everybody is going through a difficult time when they're diagnosed with pancreas cancer. And I meet them where they're at on whatever issues they want to work on, including just getting ready for the long haul.
And do you work specifically with a lot of pancreas cancer patients? And do you see a difference, in the way that you approach treatment with pancreatic cancer specifically?
Yeah. So from my perspective, the people who have pancreatic cancer are very diverse. They're not at all a type of person. So for me, I start with who they are. And it's not necessarily about the fact that they're a pancreas patient. It's about how they're coping with this incredibly difficult thing that they're going through. So that said, there are some unique challenges to coping with treatment for pancreas cancer, including just the length of treatment from neoadjuvant to surgery to adjuvant treatment. It's a long haul. And how do you get through something like that? Additionally, there's some evidence that there can be some relationship between some depressive symptoms and the cancer itself. So I definitely check on mood symptoms to find out if the patient is feeling different than they have in the past. Are they really struggling with things in a way that they haven't in the past? And then, some of the other issues are interacting with family members when there's something so scary as cancer going on. Family members can have interesting reactions. They all want to help. They don't always get it right. So I also do a lot of work talking with patients about how to best interact with their family members and those important relationships to keep going through this difficult process.
And Karen, it just occurred to me that, the perception of pancreas cancer, I think in the lay press or, in even movies and things like that, I wonder oftentimes is so grim and inappropriately so, I would say, so that oftentimes, if there's a lead character and you want to emphasize that they have a poor prognosis, you give them pancreas cancer, but that's not really what happens in real life. And when you counsel patients, do you find you have to address that to maybe reset a norm that's maybe societal norm, but it's not really rooted necessarily in medical, evidence? Or what are your expectations around that?
That's a great question. Interestingly, I do bring that up and talk with patients, but I find that the patients' other providers, their surgeons, their oncologists, have actually already dealt with that question. Mm-hmm. And so that's, that really speaks to the global approach of our program to think about those kinds of issues and talk about them early. So I often find out that that's already been addressed, which is awesome. And to go deeper, the the patient may have to do a lot of explaining to other people in their lives that their prognosis is not the thing that people think of first with pancreas cancer as it being terrible. Mm-hmm. So I'll actually do some coaching about how the patient can talk about what they're going through in a way that feels comfortable for them, that conveys the information that's important for them to convey, which means this is not hopeless. I have a lot of hope left, and there's a long process ahead of me, but I am hopeful. So a key part there is often working with the patient to figure out how they're going to communicate exactly what they're going to all the people who are going to show up to help.
And you mentioned some other side effects as well, like sleeping and eating. Can you dive deeper into how you give advice for things like that?
Yeah. So sleep is one of my favorite topics and something I have some specialty training in. And to give you the short version, I love giving a whole hour-long talk on this, but to give you the short version, sleep is a behavior that is very much related to triggers in the environment. So when you get into bed at night, you want your bed to tell your brain it's time to sleep, time to relax and go to sleep. And when you're going through a long process of treatment, there's a lot of things that can interfere with that. For example, if you're experiencing pain or nausea at night, if you've been in the hospital for a while, being woken up all the time, these things can kind of interfere with that natural process of your sleep cycle kicking in at the right time in response to getting into bed. So I work with patients to get that sleep cycle back on track, to identify the pieces that are interfering with their natural ability to sleep, and to set a new pattern of healthy sleep despite what they've been through maybe in the last few months. So that's my approach to sleep, and it's incredibly effective. Research shows it's far more effective than taking sleeping medications in the long term. So I love working with patients on that. Additional behavioral issues that can come up, things like the difficulty of getting moving after a surgery. So getting motivated to be active at the level that you can be active. And that's really tricky too, because when you're recovering, you need to find the right level of activity at the right time and build, rather than go out and do too much in one day and then feel really fatigued the next day. So I work with patients on fine-tuning that and identifying their motivation for trying to be active. Other issues that come up, nausea can stick around for a while, and I have some strategies to help patients get through that. There can be some fear of eating at times because there have been digestive problems through the course of treatment, and we work on those fears. And additionally, pain and discomfort. One of the really important things for me to identify is anxiety and physical tension, because when someone is nervous or anxious about something, they tend to experience pain and discomfort at a much higher volume. It's not that the anxiety creates the pain, it's just that they're far more aware of it when they're anxious. So I can work with patients on strategies for relaxing their mind and their body to help be less aware of pain and discomfort.
Well, I know we're talking kind of in general terms, and you're giving us the shorter version, but maybe you could give our listeners just one or two tips on anxiety, because I'm sure that applies to.
Sure. So what is anxiety? Anxiety is kind of a conversation between your mind and your body. Your mind's worried about something, and that makes your body tense up. And then your body's tense, and that sends a signal to your brain to stay worried. And it's this cycle that keeps you tense. And it's not necessarily a bad thing. It keeps us on our toes. It keeps us paying rent on time. It makes sure we don't step into the street in front of a bus. It's helpful in a lot of ways. But when you're going through something like cancer, where you can worry about things all day, but you can't exactly immediately fix the problem, those worries kind of get stuck, and they get stuck in that system between your mind and your body, where you're feeling tense, you're anxious all the time, and it kind of gets stuck in that pattern. So I have two ways that I help people work on that. One, if we're looking at that communication between mind and body, we start with some body stuff, deep breathing, sometimes identifying an activity like yoga or exercise, or even just watching your favorite comedian, making sure you're getting some laughs. Figure out ways to help your body relax. And often the first strategy there is to teach some very, very simple breathing techniques. Nothing fancy. There's a lot of fancy stuff out there that people don't love as much, but I can work with people on some strategies that they can very simply add a breathing practice to their lives that gives them an incredible tool to manage anxiety by calming their body. And then the other piece in that mind-body connection is to work on some of the things going on in your mind. And if I were to tell you, for example, stop worrying about the things you're worrying about, you would say, worst psychologist ever, and kick me off this podcast. So we don't do it. It takes a little bit more nuance than that. But if we can identify those patterns and figure out some different ways to cope with them, different than just staying in that cycle, people can often find a lot of relief in that process as well. Does that answer your question about anxiety?
Yeah, actually, Karen, that has totally piqued my interest. So do you think you have time to take Miranda and I through a breathing exercise?
Oh, that's a great idea. Sure. And before I do this, let me just say, I want you to think about a deer in the woods, right? That deer's been running from bears. We're not doing the exercise quite yet. I'm just saying. The deer's been running from bears all day. If that deer can stand still near a stream and do some deep breathing, it means the bear is gone, right? It means the threat is gone. So that's a really important component of how a breathing exercise works. I think these get thrown at people sometimes without that explanation, that when you calm your body, you're actually telling your brain that there's no bear chasing you, which is useful information for your brain, right? That's helpful to know. So with that in mind, we'll go ahead and start this. And they get these, again, I'm calling it a deep breathing exercise. It's really more about long breath. So I don't want you to force a whole lot of air necessarily toward, beyond a place of comfort. We're going to do some long breathing, essentially. Okay, so sit comfortably in your chair and start by kind of feeling gravity pull at your feet and feel at your butt. Your back is leaning against the chair and your arms are kind of heavy. You can close your eyes if you want, or you can leave them open, whatever's comfortable for you. And then we're going to start with a long breath in through your nose. Hold for just a moment, and then out through your mouth slowly. And pause, and in through your nose. Hold there for a moment, and then out through your mouth. Pause, and in through your nose. Hold for a moment, and out through your mouth. Pause, in through your nose. Hold, out through your mouth. Pause, in through your nose. Hold, out through your mouth. One more time, in through your nose. Hold there, and out through your mouth. Kind of rub your thighs and open your eyes and come back to our conversation. All right, Susan, what did you notice when we did that?
I really noticed actually the exhale.
Okay.
I think I don't really usually appreciate necessarily like breathing, but I really appreciated the time on the exhale, like that. There was kind of another level of awareness that, when I was just focusing on breathing and specifically on the exhale, for some reason, I felt a little bit more conscious. Awesome.
Great. When I'm doing it right, I just feel my shoulders drop a little bit. Mm-hmm. And that's kind of how I know I'm in it. And then in terms of thoughts of the day or worries, did either of you notice, was there anything going through your head while we were doing it, or did it calm down?
Silence.
All right. We did it. We did it. So as you can see, that's a really simple exercise. I think it took 1 or maybe 1.5 minutes there. And what I encourage people to do is to do this a couple times a day, every day. So what I am not talking about is sitting on the floor and meditating for 20 minutes. That is not a great place to start. I can't do that. So this 1 to 2 minute breathing exercise, very simple, a couple times a day. I actually encourage people to start by only doing it at times when they're feeling not stressed, when they're feeling mostly normal, because I want patients to have a chance to get good at it. And if you only do it when you're feeling panicky, then it's like going to the gym and trying to run a marathon on your first day. It's just too hard. You need some opportunity to practice using some breathing to calm your mind and your body. And then after really a week of doing this a couple times a day, all of a sudden you have this amazing tool to bring that tension down anytime you want to do it. It's really kind of an amazing thing to get going with.
And I mean, I think it's one of the things that I've noticed, because I try and practice when I can some deep breathing techniques. But I think we all take for granted how wound up we are on a day-to-day basis. So for me, I actually use an app to help me breathe, but they'll say like, just relax your tongue. And I remember the first time I heard that, I was like, why is my tongue not relaxed? But I mean, I think you hold so much tension like on a day-to-day basis that you don't even realize until you stop and you just take a moment to focus on something different.
Right. Absolutely. By the way, I love those apps. Those are perfect for practicing. But the end goal, and especially for patients going through cancer treatment, is that they have this tool in their tool belt at all times that if they feel some anxiety come up on them when they're waiting for a blood draw, something simple, that in that moment, they can just step into that breathing exercise and have it there for them to comfort them. Kind of like your baby blanket when you're a toddler. It takes the edge off.
That's a question that I was going to ask Dr. Tsai, is if you had any tips to help remember to do this in the moment.
That's a great question. A family member can help. Family members are good at pointing it out and helping you to remember the practice. But the kind of magic's the wrong word, kind of magical thing that happens when you practice this a couple times a day for a week or so is your body starts to remember it. So that when you're feeling tense, your body kind of does it almost automatically once you've had some experience with it. So that's the cool thing, is you don't even have to be thinking about it really intentionally to get some benefit out of this once you've practiced it for a while. And that's really where I like to help my patients get to, so that they have this automatic tool to calm down when things are feeling scary.
That's been my experience too. People talk about like counting to 10 or, doing something when you're like angry or stressed out. But I find that you definitely remember how you feel when you're deep breathing. And then it somehow it triggers something in your mind when you're stressed, like, oh, I just need to take a moment and just take a couple breaths here. Can I ask you for other tips?
Other tips for managing anxiety and stress?
Well, actually, I was thinking about what you said earlier about maybe setting boundaries, because I think a lot of patients, there's a lot of, I feel like, guilt and responsibility that they feel. And so, I think sometimes it's overwhelming that, and I'm guilty of this too, like people want to help them. They don't really know how to help them. And then sometimes patients feel, forced to reciprocate a little bit and accept the help when sometimes they just want to be alone. So can you give some tips on what you tell people in terms of setting boundaries? This is going back to your discussion about conversations and other things.
This is a really great question. And I think the bottom line thing to remember before you even get into boundaries is all the people around you, they want desperately to help. They really, really want to help. And almost, well, not all the time, but a lot of the time they get it wrong. They don't help in ways that are useful. They say the wrong things. They start talking about their sister who had breast cancer. They ask, questions that aren't quite appropriate or maybe beyond a personal point of comfort. So you've got all these family members around you, and their desire, it's important to remember, their desire is to love on you, to be helpful, to be there for you. And they're just getting it wrong because they don't know. So unfortunately, that kind of places a burden on the patient to help people around them know how to help them. And that That's unfair. I wish that weren't the case. That stinks that burden gets placed on the patient, the last person who needs that. But what you can do, some strategies for this are, one, making a list ahead of time of the things you could use help with. Then when someone says, let me know if I can help, you say, oh yeah, I've got this list. Is there anything on that list that you'd be comfortable with? And that's good because you don't have to assign something specific. Also, the person that you're talking with can look at the list and find something that's comfortable for them, because different people can help in different ways. So that's one really important strategy. The other one is to try to get comfortable telling people what you need. If you need them to talk about their screwed up family rather than ask you about cancer, that's okay to say. The people around you, again, all they want to do is know that they're getting it right. They're knowing that they're being helpful. So if you give some small direction, like, I don't feel like talking about my health today. Can you tell me what's going on at work? If you kind of practice those kinds of phrases, and which I often do with patients, we actually kind of role play this, figuring out something that you can do to nudge people away from what you don't want to talk about and towards something that will help you feel more normal, like you're just getting the news of the day in a comfortable way. So those are kind of my top two things. And remember, they're based on this deep belief that I try to help patients foster that everyone around them genuinely wants to help, which is true.
That's great. Thanks.
So, it sounds like your job can be pretty heavy at times. How do you deal personally with, coaching patients all the time and just constantly giving and, just dealing with a lot of this negativity around your atmosphere?
Yeah. Wow. That's a really thoughtful question. Thanks for that. And it's a good question. First, I would say, someone like myself, a trained professional, this is self-care for me, and being able to cope with the issues that my patients are bringing to me is something that I have been trained on specifically. So managing how I feel and how I'm doing is part of my training, and I've got a solid skill set on how to do that. And that's really important for therapists. I certainly think of my patients often, but I have developed the skills to be able to let go of those issues when I head home to spend time with my family. And I think that's actually important for patients to know, because I don't want them worrying about me. The beauty, the magic of therapy is that you don't have to worry about me at all. I am there for you in that moment. And I know how to cope with my stuff, and I'm only here for your stuff. And that's kind of the beauty and the magic behind therapy. I keep using the word magic. It's not the right word. It's how therapy works. And then additionally, I would say, having only been in the cancer center for 2.5 years, I worried about this a little bit going in. Would I be comfortable all the time? And my goodness, it is one of the most cheerful places I've ever worked. There are just so many people there to foster hope and to meet the needs of cancer patients. So I find the environment itself to be healing and supportive of me as well. And I just feel really grateful to work in that kind of a place.
That's awesome. Maybe we can touch on people that aren't necessarily at the Medical College of Wisconsin, and perhaps their facility doesn't have someone like you available to them.
Sure.
What would you say to encourage them to seek it out?
That's a great question. And so on one hand, in one sense, what I would encourage patients to do is look for a health psychologist in their community. That would be a great place to start. And these days, therapists have pretty significant websites where they write about the things that they specialize in and their approach to therapy. So I encourage patients to, maybe look at the providers that are on their insurance list and go check out their websites and their personal statements. Spend some time on it like you're doing online shopping. Dig in and find the best possible option for yourself. And then try to make an appointment, go ahead and do that. But keep in mind that finding a therapist is kind of like I said, kind of like shopping for shoes on the internet. You might know what you're looking for, you know the size and style you're looking for, but you don't know if it'll be a comfortable fit until you get them on your feet. So keep that in mind. And if it doesn't feel right within the first 1 or 2 sessions, it's okay to find the next person. It is not that that's a bad therapist or that they will feel like you're rejecting them. It just may not be the right fit for you. So in that sense, it's a little like online dating. Again, you can pick out the right statistics and the right height and weight, but you don't know until you get there if it's going to be a fit. And really, I try to empower people to feel confident that if it doesn't feel like it's comfortable for them, not necessarily that it helps immediately, but that if it's not comfortable, they can go and seek another option.
So if you've never had therapy before and maybe the whole idea is a little bit uncomfortable for you, how do you know if it is a good fit within the first 1 or 2?
That's a great question. I'll give you some like specifics, but then also talk a little bit of how you might want to feel after a first session. So specifically, you'd want the person to take a good history of your relationships in your life, past stressors, find out how you tend to cope with things when you're feeling good and how you tend to cope with things when you're feeling bad. So these are the kinds of questions that would lead me to think this person is getting what I'm going to need as a cancer patient. And then on the feel side, you should feel comfortable. If the therapist makes you feel on edge, worse than you did when you came in, then it's probably not a good fit. It should feel comfortable and warm. You might feel sad. You may be talking about some really difficult things, and feeling sad is fine. That happens, but you shouldn't feel more anxious than you did when you went in.
And Karen, I think you and I have talked about this briefly in the past, but we've been focusing a lot about the patient's support. I think sometimes the caregivers often require, I think, some help as well. So maybe could you speak a little bit about that for caregivers? Should they also see a health psychologist, or what are your thoughts there?
Yeah, I don't necessarily. I think the caregivers don't necessarily need to see a health psychologist specifically, but a counselor or a therapist. And when I say that, the 3 degrees that are good to look for are licensed professional counselor, masters of social work, or a PhD or PsyD in psychology. So you're looking for a psychologist, a licensed professional counselor, or a social worker. And so I do think it's important for caregivers to seek that kind of support. And the tricky thing is often caregivers feel like they're not the one in pain, that they're constantly worried about the patient and not worried about themselves. So it can be a difficult hurdle to get to the point where they see that they deserve help as well, that this is also something help happening to the caregiver. So I think those are really important conversations for the caregivers to have with their family members and even the patient themselves, to be able to spot when someone's struggling around them and encourage them to seek help or just take time or remember to do the things that help them feel well. There's a lot of strategies to managing caregiver burden, and it's useful for everybody in the family system to be thinking about that.
So it sounds like, just to recap, that if caregivers choose to seek out help, it maybe is not a co-counseling kind of setup. It's more of a separate environment.
Absolutely. And for example, in my work, I can only see patients who are patients at the cancer center. So, and it is important for caregivers to have their own therapist and to be able to specifically work on their own issues. If there's actual marital conflict, then couples counseling could be appropriate, but that's not for necessarily this caregiver stress. Yeah. You would start with your own individual therapy rather than doing family therapy. Good question.
Great.
And what about insurance? I know you mentioned it. Is this something that's usually covered by most insurance agencies, or do you find that a lot of times people have to pay out of pocket?
Yeah, it's usually covered at this point. And there can be sometimes limits on the number of sessions, but it is, I rarely find any problem with insurance coverage. And honestly, if you've got all the expenses of a cancer treatment, the cost of therapy for the insurance provider is very minimal compared to everything else you're going through. So I don't, and it makes sense to everyone that having therapy when you're going through this process is important. And I should say in particular, you don't even need a mental health diagnosis to get work with a psychologist. If I'm working on, for example, an issue around, eating or any of the behavioral issues that I mentioned before, the billing takes place under the diagnosis of your cancer itself. You don't need a mental illness diagnosis to have an insurance provider, an insurance carrier pay for this.
That's good to know. Well, is there anything that we missed? Anything that you wanted to add?
No, great questions. And I really appreciate the opportunity to talk about what this is actually like, to dispel some of the stigma around mental health treatment, and just to talk about this amazing opportunity, this amazing job that I have that I love so much.
Karen, thanks for all that you do for us.
It's great to be here.
So lucky to have you.
Thanks so much, Susan.
And yeah, thank you for joining us. Hopefully we'll be able to have you again sometime.
I would love to. Yeah.